Communities and organizations across the country are marking Mental Health Week, with this year's theme being My Story. According to the Canadian Mental Health Association, this year's Mental Health Week aims to shed light on mental health care champions, programs, and communities, while also advocating for a universal mental health care plan for Canada. And the CMHA isn't alone in its push for a universal mental health care plan. A recent survey conducted by the organization finds that 87% of respondents also agree with this sentiment. And out of the 35% of respondents who experienced a mental health related concern in the past year, over one-third did not have access to help. Now, this was because it was too expensive or hard to find. Well, joining us now to talk more about this year's Mental Health Week is Miss Margaret Eaton, National CEO of the Canadian Mental Health Association. Miss Eaton, welcome back to Forum Daily.
Thank you so much for having me.
So, what would you say are the main takeaways from this research for policymakers, and how does this year's theme of My Story tie in to this latest study?
Well, we've been very concerned, especially since the pandemic, that many Canadians are suffering. We know that at least 20% of the population will experience a mental health disorder in any given year. But because of COVID and because of the economy right now, we know even more people are suffering through mental health challenges, and children are particularly affected. So we would very much like to see more investment in universal mental health care, which basically means you could use your provincial health card to go and get the care that you need, when you need it, where you need it.
And we know this year there's a strong focus on community based supports and frontline workers. So, what have you been hearing from community based organizations and frontline workers when it comes to the demand and as well as the capacity for mental health services amid all this need?
Well, we have CMHAs, Canadian Mental Health Associations, in 330 regions across the country. And we know that the phones have been ringing off the hook. Many of our programs have long waiting lists, and we don't feel like we have the resources to actually support the Canadians who call us in dire need of help. And this is for things like substance use health, eating disorders, peer support groups, counseling, and psychotherapy. All of the things that Canadians need for their better mental health, but can't seem to access.
So, how important is affordability and access when it comes to addressing what many are calling a mental health crisis in our country?
Yes, our survey found that 69% of people living in Canada believe it's a crisis. But what we also found, as you noted, is that when people go to look for care, they either can't afford it or they can't find it. So if you think about it, something like psychotherapy can cost hundreds of dollars an hour. If you have an employee healthcare program, you may be able to access some supports, but many people don't have that kind of support. And we're particularly concerned about people who are marginalized, people with disability, the LGBTQ community. These are folks who experience greater mental health care needs, but also cannot often afford the care. And we know if you live in certain parts of the country, you're not going to be able to find that care. So if you live in the north, if you're in a rural community, it can be that much harder to find the care that you need.
And especially if you're living in the north or a rural community, community-based programs are key here. That's what the CMHA is highlighting. So, what would a community-based program nationally look like ideally?
Well, we would really like to see a model like in the United Kingdom, where if you're suffering from anxiety or depression, you can go to your local health center and get free care. Usually it's cognitive behavioral therapy and access to psychotherapy, which is really the gold standard for care for these kind of issues. Right now, we don't have that kind of accessibility and care in Canada. So we look to the United Kingdom and the European Union as real models for how universal mental health care could actually work.
It's clear that a lot of steps need to be taken. Just about a minute left here, Ms. Eaton, but what kind of supports are currently available for Canadians experiencing mental health concerns? And more importantly, how can they get access to them?
Well, right now, Canada is spending about 7% of its healthcare budget on mental health. We would like to see it go to about 13%. But in that 7%, there is support through community organizations. So we encourage you to visit cmha.ca to find a local healthcare organization in your community that can help. And if you're suffering, we also suggest wellnesstogether.ca, which is a federal government program that actually offers a couple of free hours of psychotherapy. It's not enough for most people, but it will get you started.
Not enough, but enough to get you started. Again, Miss Eaton, thank you again for joining us today on Forum Daily for this important conversation.
Thank you so much.